Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts, and I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half-century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Join me every week for conversations with current and former students to hear their funny and inspiring stories as we learn about their journey to higher education, the role that LFCC has played, where they are now, and where they plan to go. We'll also talk to current and former professors about their experiences and best memories of LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcast, Google Podcast, on Spotify, Amazon Music, wherever you listen to podcasts. Just search for LFCC Stories. Hello and welcome to The Valley Today. I am your host, Janet Michael. Happy Friday as you are listening to the show today. It is United Way Day on the airwaves. However, we are way ahead of the curve and are recording our conversation on a Monday afternoon. Elise, I would say, how was your week? But you don't know yet because you haven't had it. So how are you doing today?
Pretty good. We have had a very busy day so far at United Way, and if things continue on the same trajectory, we're going to have a very busy week as well.
Alice Awareness Week is going on. As people are listening to this on Friday, it was all week this week.
Absolutely. We are doing Alice Awareness Week for this entire week, and then all of next week as well, to really spotlight the Alice population and the struggles that 41% of our community is facing.
And your guest today is Pam Murphy. She's the executive director at the Shenandoah Community Health Clinic. And Pam, I'm guessing that the Alice population is probably the largest portion of the clients and the patients that you see at the clinic.
We definitely serve the Alice population. We serve folks that fall even below those income levels. We will help folks that have insurance and are above that as well. But certainly the majority of folks, and particularly these days, are really struggling to make ends meet. And sometimes that means they go without medicine. Sometimes that means they go without counseling. Sometimes that means they go without dental care. So we're kind of trying to fill those gaps for folks that would struggle to get all of that done for themselves.
And you guys have two arms. I mean, the community health clinic has a medical arm and then it has a dental arm. So tell me first about the medical part of it. What kinds of services do you offer from a medical perspective? Everything.
We're a primary care practice. So we could do women's GYN services, not obstetrics or anything like that, but the typical checkups and that includes, children all the way through adults. We do the cancer screenings for ladies. We do, most of our population, honestly, is folks that have chronic diseases, that have diabetes or high blood pressure or problems like that, where they maybe need medicines, need to be checked frequently. It's even more prohibitive for them to, try to maintain medical care because they might need, $2,000 worth of medicines every month and have multiple conditions that they should be keeping track of. So that would be the majority of our patients, but we also see fairly healthy kids that just need a physical for school, all the way to older people that are in better shape. So the whole gamut. But we do have a doctor who can treat all of that. We also have psychiatric services. And that is a lot of folks that potentially might need medicine. They have depression or anxiety and they might need medicines to help control that. And then thanks to the United Way, we also have funds for and see folks for therapy, for counseling. A lot of that happens in the schools, generally when the schools are open, and that's been an interesting time for us. But some of it also happens here on site. So we see children and adults and families to help smooth the waters for folks that are struggling with those kinds of issues.
In a more therapeutic setting.
Yes. Mm-hmm.
And then what about the dental clinic?
We have funds from United Way to help specifically the low-income uninsured people there. We do take Medicaid and we take insurance in both clinics. And the dental clinic does take Medicaid, but there's a large population that doesn't have any health insurance, especially dental insurance. And so, there's nothing worse than waking up with a terrible toothache or not being able to sleep because you have a terrible toothache. And we have services 4 days a week, in part thanks to the United Way and the funding that helps us sustain, because our dental patients might pay $35 or $50 for an appointment and get some significant work done for that price, obviously much less expensive than a private practice would be. So it's an important service, especially for these folks that probably wouldn't get it otherwise. We've had a lot of nursing homes, not so much in COVID, but they are one of the clientele where they can't, Medicare does not pay for dental care. And so, we'll have a nursing home van drive up and bring in a couple of patients, and, and then the next day it'll be a different nursing home, different van, couple more patients, and because they just cannot get the services, otherwise. So there's a strong need there for that help.
And I think that's just insane too, because I have a regular series that I do in partnership with Valley Health, and they bring a slew of doctors in, a different doctor every month, and we're talking about different health issues. And I have learned through that series that dental health is one of the key things to your overall health. So it seems crazy to me that just wouldn't be part of your regular staying healthy routine.
It is crazy. There are several things in our healthcare system where for some reason they're kind of set aside, like not part of the general health, but yeah, we can, people with diabetes or high blood pressure, there's definitely correlations between their dental health and their chronic care conditions. So you don't want either one of them to get out of hand, because it will affect the, other systems in your body.
One of the other things that we had discussed during one of the shows was the concern that some of the doctors had that people were not getting their regular maintenance health checkups. They were afraid to go to the doctor or go to the emergency room or urgent care if there was a more pressing problem. Are you seeing the same thing where people aren't coming in, or have you had the opposite where everybody is flocking in because of COVID?
No, you're right. The people who, it's one thing if you think you might be worried about COVID, you may call us for that. But a lot of the folks who have depression or our psychiatric provider worries that people who she only gave a month's worth of medicines to, should have been back a couple of weeks ago or what have you. So a lot of folks have kind of put that on the back burner. I don't know if we're just also distracted. It's hard to work in some of these other things, but dental, medical and behavioral health particularly have been quieter for some reason. I guess maybe it's the dental pain. If you need help, you will get in.
Yes. It's funny how that works.
That's one of the spooky things about your mental health or your medical health. You sometimes don't know that something's breaking down until it gets really bad.
Until it's broken.
Until it's broken. Yeah. And so, yeah, we are concerned, and we're especially concerned now with flu season coming and things like that. It would be wonderful if people would make appointments with their regular provider and get in and get their checkups or get their GYN services or get all the things that they should do, because it is going to be harder in flu season. The practices, all the health practices are going to be busier, and they're going to have a lot on their plate, and they still will want to help you. But, you're just being out in public, you're going to get more possibility of getting the flu or COVID or something else. So
you mentioned that a couple of those programs are partially funded through grants with the United Way, but the people that come in otherwise, is there like a sliding scale? I mean, is it, how do people pay when they need some of the services that your clinic offers?
You're right. The medical and behavioral health, it definitely has a sliding scale. The dental services only help up to a certain income level, and they have a flat rate if you don't have insurance. And the 2/3 of the people who come through the dental clinic have Medicaid, which is not a great payer source, but it's certainly easier than the 35 or more money than the $35 that an uninsured person would pay. So it does help to subsidize, along with grants, those folks that can't really afford to pay for all their care.
Well, let's take a quick break. We talked a little bit about COVID. When we come back, can we talk a little bit more about how COVID has had an impact on your fundraising? Because just because some of these things are subsidized by United Way or Medicaid or somewhere else, it doesn't mean that you're getting them for free. You still have things that you guys have to pay and buy for. Can we talk about how you're making that work in COVID?
You are right. Yep, that'd be great.
All right, Elise, are you going to hang out with us? Of course you are. Where are you going? We have to talk more about Alice, so we'll be back. We're going to take a quick break. When we come back, we're going to continue our conversation with Elise from United Way of Northern Shenandoah Valley. Joining us on the Zoom screen is Pam Murphy. She is the executive director at the Shenandoah Community Health Clinic, and we're going to come back and talk with both of them in just a couple of minutes.
Do you know anyone who is struggling with financial hardships because of coronavirus? Our new webinar called Coping with the Money Crunch can help. We'll talk about immediate options to consider, revising or creating a spending plan, and lots of community resources. Then we'll cover how to narrow your priorities, contact creditors, and avoid scams and risky loans. The webinar is free, and you can either join by phone or through Zoom on a smartphone, tablet, or computer. You can find out more by visiting the Northern Shenandoah Valley Financial Education Program on Facebook or calling Karen Poff at 540-635-4549. Let me show you how to make your own plan or help someone you care about get through the crisis. Call 635-4549 or visit @NSV Financial Education on Facebook today.
Welcome back to the Valley today. I am your host, Janet Michael. Happy Friday. Happy United Way Day Friday as you are listening to the show today. We have pre-recorded our conversation, however, on a Monday afternoon. We are chatting on the Zoom screen with Elise from United Way of Northern Shenandoah Valley, as well as Pam Murphy. She is the executive director at the Shenandoah Community Health Clinic. And Elise, we talked a little bit in the first segment about some of the United Way grants that help keep the Shenandoah Community Health Clinic going. Those are a big deal that United Way loves doing those grants because you really do get a bigger impact that way.
Absolutely. Well, many of us know all about healthcare now more than we ever want to know, thanks to COVID. But we've been watching healthcare trends, especially in Shenandoah County, for a long time. And we know that there is a massive need and a lack of access to affordable healthcare for the residents and people who are either in the Alice population or who are in poverty. And so that's why this year we were very proud to be able to award our largest combined grants for the dental clinic and the regular health clinic, with over $50,000 worth of support this year, because we just really wanted to be able to stand behind our residents in Shenandoah County and to do whatever we could, especially for the youth with the mental health issues we're seeing trending throughout that region. And so we are very excited again to have the Shenandoah Clinic here with us, and Pam here speaking on behalf of some of the trends and issues we've been seeing in that county.
And Pam, it has been crazy with COVID. I mean, and $50,000 is a huge amount of money. And I'm sure you are beyond grateful that you were able to apply and then get approved for that grant. But it's probably a drop in the bucket compared to what you need to keep all of these services and these programs available to Shenandoah County residents.
Well, it's a big drop, but you're right. We have just been amazed at how many, like many businesses, how many additional expenses that we have. We had to, within a 2-week period, completely convert as many systems as possible into telehealth. That was interesting, and software cost to that and monthly subscription cost to that. If you saw our dental staff, particularly with certain procedures, it looks like they're from outer space. They have bonnets on their head, goggles on their eyes, a face shield over their face, the N95 masks, the robes, the booties, the gloves, everything. And we always obviously use some of that, but not to anywhere near the degree that the amount of things that we need now. And so that has really, it's put a hurt on us as far as cost, because all of those items now are tremendously expensive, sometimes triple what we used to pay for them. And so that's been a big issue as well. So we just seem to be accumulating all these costs, not to mention, honestly, that there is some infrastructure costs involved with that, because, the providers, there's a lot of time sometimes that we're taking to try to get a patient into the telehealth. It's like Zoom, but, to help them understand the
Training.
technology, make sure that they're hooked up, so our staffing costs, per patient are actually higher. Our medical clinic oftentimes will, generally speaking, the lower income folks will pay $5 for a medical visit. And, oddly enough, some of them think that they shouldn't have to pay because they didn't actually come in, and we're like, oh boy, you have no idea. This actually is costing us more, than when you used to stop in and we could see you and get it done and get out the door. So yeah, it's a very different time, but it's a more expensive time, all around.
Pam, it sort of sounds like you guys have all your costs have increased while the need, of course, is probably skyrocketing still.
Yeah, it's difficult. Definitely in the dental clinic, we had to close due to the governor's shutdown for elective surgeries. We stayed open one day full service, one day for service, which was emergencies and extractions. And then we had the dentist come in, that was on a Thursday, and then we had the dentist come in on Monday and try to screen calls and make sure, who had real urgent situations and who needed to be seen. Because he would bring you in on a Tuesday or Monday afternoon or whatever if there was something really critical going on. But we did that to try to help save the impact on the emergency rooms, because we have heard over and over again from those doctors that that's one of those things that comes all the time, and they can't do anything about it except give you an antibiotic and send you on your way, and then you're back in 2 weeks and say, I'm bad again, So we were trying to do those services. So now we're in this situation where we've reopened, and with all the protective gear, and actually I didn't even mention, but we have bought some specialized equipment to help pull the aerosolized saliva and all of that, the breath. Actually a vacuum that's near your mouth that can suck in the breath as you're breathing, so that our staff is exposed as little as possible. But anyway, more equipment, more needs. And a lot of our dental patients that we kept putting off because we were closed are getting frustrated, because it's been difficult to get in and get normal things like hygiene and such done. So those needs have continued to go up. On the medical and behavioral health side, as I mentioned, seems like folks are a little bit worried about coming in the doors, and I would just really encourage everybody to get in with their own practices, or us, because we open to help more folks. But get those checkups and get some of the ordinary maintenance types things done, because the longer you wait, the more problems you might be having.
I know that we've had a lot of clients that have come in and reached out to us at United Way, people that have changed jobs, that have lost their jobs due to COVID, people that are in transition and are dealing with a lot already. Healthcare might be the last thing they're trying to worry about until it gets really, really bad. What would you say to our ALICE population and our clients who have lost jobs, who might suddenly be finding themselves uninsured? What would you recommend that they do?
If you live in Shenandoah County, you should definitely come talk to us or call us. I guess you could just call us and we could give you the information about how to get started. We're revamping our website, but we'll soon have a lot more information there with more details. Certainly if you live in Winchester, Frederick, or Front Royal, Warren, there's free clinics there, and I would encourage folks to contact their free clinics, because they are, that's a big reason why the free clinics exist, is to try to help lower income uninsured people. And during the last recession, we just saw a ton of people who had not known about us, were almost embarrassed to try to come and talk to us. And we kept trying to say, oh my gosh, no, like I have. I mean, all of us have hit some hard times in life where you had to, break down and use some of these systems that are actually set up for our neighbors to pull them through a tight spot. So I would definitely encourage everyone to get in touch with a free clinic or our Shenandoah Community Health Clinic.
And I think you're right, because it is a matter of perception, and we don't know what we don't know. And a simple phone call to whatever free clinic is in your area, in your case in Shenandoah County, they can ask as many questions as they want. You can give them all the information. You can direct them somewhere else if needed. It seems like a simple thing, but you're right. People sometimes are hesitant, and that's kind of what we're hoping today is to tell them, don't be hesitant. Just pick up the phone and at least make that initial phone call.
Yeah, and I would even encourage folks that may have tried in the past and were told that, they were a little over the limits or something like that to try again. A lot of the free clinics have been able to expand their parameters and see more people. When Medicaid got expanded in Virginia, that opened up more room in the clinics, so they were able to, be more flexible and open up their parameters. So I would say, if nothing else, they might, if they can't help you, oftentimes they do know other resources that you could tap. Or they have, like us, they have a program that helps you with medicines. If that's what you need, you just need to get free medicines. We can do that paperwork for you. You don't even have to be a patient of ours. You could be a patient of another doctor, but still come to us and we can help get that paperwork done, because those medicines are terribly expensive. So, everybody could use some help with that, irregardless of what's going on. We saw in the last recession that there were a lot of people who they had a high mortgage or something like that, where it wasn't so much that we would say, oh, these people are poor. It's like they did not have the resources they needed right now, this month, next month, because their income had been halved or, something like that. So sometimes we all just need a little extra help.
So if somebody is listening today and they want to reach out either to inquire more about the services for the Shenandoah Community Health Clinic, or they want to help you, they want to write you a check, preferably one with a comma in it, so that you can restock up on some of your PPE, or they just want to make donations, where is the best first place for them to start?
Well, an easy place would be to look at our website. And we do have a website. It's going to be improved, but we have a website that's shenclinic.org, www.shenclinic, SHEN, short for Shenandoah, clinic.org. So that would give you some basics about the facility. Our phone number is 540-459-1700. And they can answer some questions or, as I said, help redirect you if we're not quite the right fit.
Awesome. And at least Pam was saying that, in some cases, it's not that people would necessarily be classified as poor, but they're just stretched to their limit, which is kind of the definition of ALICE to a certain degree, isn't it?
That's absolutely right. ALICE is an acronym. It stands for Asset Limited, Income Constrained, Employed. They used to be called the working poor, but basically it's 41% of our population through the northern Shenandoah Valley on average. And those people are people who are making tough decisions every day. And I get the privilege of reading the grant reports from our agencies, and we see it all the time, especially with our health clinics, where people are making choices between things like medication and paying rent or keeping their car working, and so they can get to work, and their medications. And we see people making the tough choice of putting that money towards their car to keep getting a paycheck, but then they're making do without medications. And so that's just why it's so important to take a look at some of the programs in the community. And if you're struggling to figure out where to go on your first step, I encourage you to take a look at our website at United Way of the Northern Shenandoah Valley. And we have a great Get Help button where we can start triaging all the issues that you may be looking for help in. From anything from healthcare to housing to employment to childcare, you name it. We see it all, and we really pride ourselves on connecting people in our community to the services that we have here. But our website is UnitedWayNSV.org.
They can get information about ALICE Awareness Week as well, since it's happening all through next week as well.
Absolutely it is. And as we were kind of talking about a minute ago, these people are stretched thin, and sometimes it's just $100 or so short in some areas of their life. So over the next week, we have one more week left in it. So next Friday, we'll be wrapping it up, and our goal is to raise $10,000 for our ALICE Emergency Fund. And these are funds that help people in emergency crisis situations when there are no other situations and no other pots of money sitting around that are ever really sitting around. But there are no places that we can pull funding from other programs. And so we find some people fall through the cracks in these really tough times. And It's just $100 or so from a car payment that's keeping a family working and a paycheck coming into a household. And so that's our goal, is to raise $10,000 to help at least 20 families here locally in our community. And so if you're curious about helping Alice, please do check out our website, which is again, United Way of Northern Shenandoah Valley, UnitedWayNSV.org.
Anything else?
We do have one other thing going on with us at United Way. We encourage you to take a look at a special survey that we are working on with all the United Ways in the region, which is an Alice report survey on COVID and the effects of COVID on people of all demographics and income levels throughout the Northern Shenandoah Valley. So it doesn't matter where you live. If you're Front Royal, if you're Harrisonburg, if you're all the way up to the West Virginia border, we need you to take the survey. The survey link is bit.ly/UW COVID survey. That is the link to go to. You can see it all over United Way's Facebook here in Winchester, as well as the United Ways around Harrisonburg and in Front Royal, Warren County. It is so important that we collect this data because we want to see what our population is doing, how they're getting by during these crazy COVID times. And we're excited that it's being produced by the people who do the Alice report for us. So it's a whole nother party, but we do need those survey respondents to participate in us in United Way of Winchester, Northern Shenandoah Valley area. We need 1,000 respondents for our region alone. And if you do participate, you are entered to win. So we have some gift cards we are giving out. So it is worth your while. The odds are decent, I would say. So please go to our Facebook, Instagram, etc. For United Way of the Northern Shenandoah Valley to learn more about that survey. And please take the survey.
I will put the link to shenclinic.org for Pam on the show notes page, as well as the link for the survey and for Alice Awareness Week and United Way's website. Everything's up already on the podcast page, so that'll make it even easier for somebody that's listening now. They can just go find it from today's show. We are going to wrap up. It is Friday, so I hope you get out and have a good weekend. I'm not sure. I haven't mentioned it much this week because they're still relatively new. I was telling the ladies before we started recording, I have foster puppies from the Winchester SPCA. So where I would normally say go out and have a great weekend, I will still say that, but just know that I will be home taking dogs out every 30 seconds, it feels like, to go poop. I'm just saying that's going to be my weekend in a nutshell. I'll meet you back here on Monday. I'll have a brand new episode of The Valley Today ready to go for you just a few minutes after noon.